哦，咁我要拍埋呢堂week 七嘅 concept of self 嘅 tutorial 啦。咁第一個 scenario 就係 suicidal ideation in acute ward。acute ward。咁我係一個 year two nursing student 啦，on placement in an acute psychiatric ward. It is your first week. A 25-year-old man with major depressive disorder tells you in a flat tone, "Honestly, I don't see the point of living anymore. No one here really cares. You are just doing your job." 咁如果我要 show 我嘅 high emotional intelligence 咧，咁第一個係 self 呢個 awareness 啦。咁我要即係我要 recognize 我自己嘅 feeling 啦。咁我可能會有少少緊張啊，overwhelmed 啊，或者唔係好確定啊，因為呢個係我 first week 啊。咁 self-regulation 咧，我應該係要，雖然我係緊張，但係我一定要保持呢個冷靜同埋保持冷靜。咁而且我要知道啦，我自己點樣有咩感受，同埋避免呢個投射一啲唔即係 discomfort onto the patient 嘅。第二就係 self-regulation 啦。咁我要 control 我自己嘅 response 啦，avoid reacting with shock or dismissiveness 啦。咁仲有呢個 maintain 呢個 composure 啦，speak in a steady calm tone。咁仲有即係例如啦，咁我講嘢之前深呼吸，放慢個語速，咁俾佢知道，同埋講嘢個語氣要肯定啲，俾佢知道我係支持佢嘅，而唔係即係話真係返工咁樣講兩句就算。咁仲有第三就係呢個 empathy and social skills 啦。咁我要 show 我自己係知道，我要明白佢嘅痛苦嘅。咁 active listening 咧，仲有好重要嘅。之前 lecture 講過 active listening 啦，要聽下佢點講啦，聽下佢分享佢嘅即係有咩難處啦。咁 social skills 咧就包括我要做啲肢體動作啦，open body language 啦，咁同佢有 eye contact 啦，同埋避免講嘢好急促咁樣。咁仲有咁如果即係有必要嘅話，咁我就要咁我就要可能要同其他同事溝通啊，咁樣可能要轉護士去幫助佢。咁第四就係呢個 burnout 同埋 coping link 啦。咁我要 recognize that hearing suicidal ideation can be emotionally draining 啦，即係唔單止係對佢對我都有少少影響啦。咁當我成件事同佢講完嘢之後啦，咁我要即刻同supervisor 去 debrief 翻啦，講翻佢有呢個自殺嘅念頭啦。咁仲有教佢 practice 呢個 self care 啦，同埋 seek 呢個 peer support 嘅，即係睇下有冇啲其他嘅病人有成功戰勝呢個可能焦慮嘅經驗咁樣，咁可能有 peer support，可能佢就會復原得好啲。咁仲有呢個 professional boundary 咧最重要啦。咁 caring deeply while protecting my own emotional health prevents burnout 啦。咁第二個 scenario 就係呢個 aggressive behaviour and personal triggers。咁個情景就係 I'm working in a inpatient mental health unit 啦。咁大約40歲嘅 man with schizophrenia become verbally aggressive when you remind him about his medication. You are all the same. You are trying to poison me. Don't talk to me like I'm stupid. 咁第一件事咧，如果我要 demonstrate 一個 high 嘅 EI 咧，咁我就要知道自己 self-awareness 啦。咁知道我自己嘅 own trigger 啦。咁我可能會咁佢鬧我啊嘛，我可能會有少少 defensive 嘅，我 intimidate 即係有啲俾人激嬲咗啦。當佢鬧我嗰陣時，咁嗰陣時我哋就有 reflect 啦，internal reflection 有。咁例如我知道我自己即係好嬲，不過我唔可以即係我唔可以 take it personally，即係佢唔係鬧緊我啊嘛，因為佢有病，佢唔係特登鬧我。咁 當我哋知道咗自己呢個情緒啦，我有一個 reflection 啦，咁我就可以避免escalation 啦，避免同佢對鬧咁樣。咁第二就係呢個 self-regulation 啦，咁我就要控制我嘅 response 啦，避免去即係提高我聲線咁樣同佢對鬧啦。咁 maintain 一個 calm 嘅 body language 啊，例如 natural posture、steady tone and give the patient space 啦。咁例如停止呼吸，咁仲有好冷靜咁樣回答佢啦。咁第三就係 empathy and social skills 啦。Acknowledge the patient's fear of being poisoned is real to him。咁我哋就要用呢個 de-escalation 嘅 techniques 啦。咁例如，咁我知道你而家好即係你好緊張，你好驚有人毒害你。不過我唔係毒害你嘅，呢啲藥係對你有益嘅。咁 avoid patronizing language 啦，emphasize collaboration。咁即係都係主要合作咯，同佢唔好提高個聲線啊。咁仲有 burnout coping skills 啦。咁呢啲 aggressive encounters 咧，可能係會對我都有少少 training 嘅。咁我就要 debrief with colleagues 啦，practice stress relief routines 啊，and remind myself aggression is a symptom, not a personal attack。即係呢個佢講嘅嘢唔係一個 aggression 嚟嘅，而係一個症狀嚟嘅。咁我唔應該 take it personally 啦。咁仲有 boundary 啦，protect 喺一切前提都係保護我 emotional health 啦。咁避免一個 fatigue。咁例如咁如果佢啱先講完，You are all listening, you are trying to poison me, don't talk to me like I'm stupid。咁我哋要以一個冷靜嘅語氣回應佢啦。咁我知道你好唔開心，好擔心啲藥係有毒嘅。不過你可唔可以分享多少少你嘅諗法啊？咁樣即係以肯定嘅語氣啦，同埋即係冇提高自己個聲線啦，問下佢而家咩諗法啦。咁social skill 啦，例如可以運用多啲。咁可能話解釋逐隻藥解釋，同佢解釋下啲藥物邊隻做乜嘢嘅。咁同佢分享啲透明嘅資訊。咁之後咧，當成件事講穩咗啦，de-escalate 咗啦，咁我就要同其他同事講啦，可能同翻上司講啦。我有少少困擾嘅，即係我有少少唔開心嘅，俾人咁樣鬧。咁我會 debrief 啦，所以咁我會 debrief 啦，咁我就唔使即係收埋咁樣自己一個。呢個就係大約就係我對於呢堂 tutorial 嘅 recording。For scenario 2, when a patient with cystinuria reacts aggressively, an EI-informed nurse can de-escalate the situation while staying grounded and protecting personal well-being. Self-awareness. Notice your own emotional surge, irritation, fear, and any physical cues. Tight shoulders, quickened heartbeat. Labeling the feeling, I'm feeling tense right now, and remind yourself that the aggression is a symptom, not a personal attack. Self-regulation. Pause. Take a slow breath, grounding breath, and keep your voice calm and steady. Use neutral body language, open posture, relaxed shoulders, and a gentle facial expression to signal safety. Set a clear short-term goal. I want to keep the patient safe and understand his concerns. Empathy and social skills. Validate his fear. It sounds like you are worried the medication might harm you. Offer choice and collaboration. Would you like to walk about what worries you about the medication, or would you prefer a brief walk before we discuss it again? Use active listening. Reflect back his words and maintain eye contact without staring, showing you are present but not confrontational. Burnout and coping link. After this encounter, debrief with a teammate or supervisor to process any residual stress. Apply a quick self-care habit, 5-minute mindful breathing, a short walk, or jotting a reflective note. It's a reflective journaling to prevent emotional buildup. Remember that regular peer support and supervision are key buffers against cumulative burnout when dealing with frequent aggression. 咁引用翻嗰課 notes 嘅內容咧，咁啱啱個 When a patient shares suicidal thoughts, a nurse who demonstrates strong EI can create a safe, supportive space while also protecting their own well-being。咁首先我哋係 self-awareness 啦，我哋要 notice our own immediate emotion reaction 啦。For example, discomfort, fear, urgency. Name the feeling. I'm feeling a bit anxious right now, and acknowledge any physical cues. Tight chest, rapid breathing. Reflect on any personal biases or past experience that might color your response, and let them set aside to stay present for the patient. Self-regulation. Take a brief pause before replying to keep your tone calm and measured. Use I statements to stay accountable. I hear that you are feeling hopeless right now. Keep your body language open. Maintain eye contact. Lean slightly forward and avoid crossing arms to convey safety without overreacting. Empathy and social skills. Validate the patient's experience. It sounds like you are feeling completely alone and that the care here isn't meeting your needs. Ask open-ended, non-judgmental follow-up questions. Can you tell me more about what's been waiting on you today? Over reassurance that help is available and that you are there to listen, then transition to the appropriate safety protocol. Contacting the assigned RN. Completing a suicidal risk assessment. Burnout coping link. Recognize that hearing suicidal ideation can be emotionally draining. Schedule a brief debrief with a mentor or peer after the encounter. Use self-care tools you've learned, mindful breathing, short walk, reflective journaling, to process the interaction and prevent cumulative stress. Remember that maintaining professional boundaries while showing genuine care helps protect both patient safety and your own mental health.